Welcome to the Enlightened Pet Behavior Podcast. I'm your host, Susan Light. In a world overflowing with conflicting advice and often misguided information, my mission is to be your trusted source for accurate, kind, and truly effective strategies to understand and shape your pet's behavior. Join me as we shed light on common challenges and work to foster a deeper, more harmonious bond with our beloved furry family members. If you find the show helpful and enjoyable, please consider showing your support, subscribing, following, rating, reviewing, sharing with your friends. It just takes a moment, but it significantly boosts the show's visibility and helps more pet parents discover it. So thank you so much for your support. Let's get into it. Today, we're talking about a really interesting topic: behavior change as a symptom that something with your pet is physically wrong. If you've worked with a behavior professional, likely the first thing they did was send you to the vet for a full workup. Why do we do this? Because behavior is communication. And when something changes, it could be a training thing, but often it's a sign that there's something physically wrong with your pet. And that means that the vet is the person who can help you diagnose, treat the root issue, and potentially resolve that behavior. It can be complicated. Sometimes after the physical issue is treated, the behavior can persist, and that's where a behavior professional can help. And sometimes it is behavioral all along. But treating the behavior without making sure it's not rooted in something physical is not only ineffective, it can be very harmful to our pets. So I'm really excited to talk about this with our guest today. She is a Florida native who earned her undergraduate degree and Doctorate of Veterinary Medicine from the University of Florida in 2015. After 5 years in small animal general practice, where she developed a strong interest in feline medicine and earned the Young Veterinarian Award from the American Association of Feline Practitioners, she became a fear free elite certified to provide low stress care. Her passion for behavior began when she adopted her dog Tico during a semester abroad in Costa Rica. Inspired by helping him through his reactivity and other behavioral disorders, she completed a 3-year residency in behavioral medicine at the Florida Veterinary Behavior Service in 2022, and she is scheduled to sit for the American College of Veterinary Behaviorists board exam in September 2026. She has been published in online journals, including Pet MD and Psychology Today, contributed to the textbook Behavior Problems of the Dog and Cat by Gary Landsberg, and has authored 2 research articles in the Journal of Veterinary Behavior. She's also frequently lecturing on behavior medicine topics. Please welcome Dr. Megan Petroff. Hi,
How are you?
I'm good. How are you?
Good.
I'd love to start by briefly talking about the case study that you recently published.
So I did a 3-year behavioral medicine residency, and one of the things that we need to do during that time in order to prepare and sit for a board examination is publish a case that was unique in a peer-reviewed journal. And so I had a really interesting case, and as you'll find out, I'm really passionate about behavior change that is actually physical illness or pain masking as behavior change, and this was a very interesting one. So this was a cat who was, I think, about 7 years old at the time she came to see me and had about a 10-month history of behavior change. So she had loss of certain normal behaviors and development of new abnormal behaviors. And so this included things like the big thing to the owners was she wasn't playful anymore. They couldn't engage her with play. And they had great videos showing dangling a toy in front of her, and she just walked by it, kind of wouldn't really even acknowledge them. She didn't really want to be pet much anymore. Not that she was a huge pet me cat in the past, but at least a few minutes a day. She didn't want that. She started to urinate outside of her litter box sometimes. She was no longer jumping on a perch where she used to look outside and watch birds and stuff. What
Wow.
else?
Yeah. That's a lot of
The major ones.
that's a lot of good things for them to notice and bring into you.
Yeah, so they had gone to a few primary care veterinarians at that point before one of them recommended referral to the behavior specialty service. And they sort of had a journey. The first one suggested to me maybe it's because she's overweight at the time, which we can see maybe contribute to things like arthritis and discomfort and slowing down. So not unreasonable for a cat who is overweight. But you know how that takes time to achieve. So they worked on weight loss several months later, cat's still the same. And so they decided to go to a different primary care veterinarian and get a second opinion. And then they had some suggestions like, well, let's work this cat up for pain. So they did some sedation, x-rays, orthopedic x-rays with radiology review came back normal. They still did a pain medication trial, which is a very reasonable thing to do because not all pain is going to be seen on x-rays, and some feline pheromones. And it, again, it didn't help. So then she was referred to us at that point, and that kind of takes us to the beginning of the case.
Yeah. Love to hear what you did.
Yeah, so on our physical exam, one of the first things that we do, so we do observation in the room to see how the cat is interacting. Do they seem mentally normal? This cat did walk around the room. She didn't really engage with anybody, which is kind of how that was going at home too. But she seemed mentally appropriate besides that. We did a regular physical exam, so head to toe, checked her out, nothing obviously wrong. And then added in because of these behavioral changes in an older cat when it comes on suddenly, we're concerned about physical health issues, did a neurologic exam as well. So that involves testing some cranial nerves, so some spots that we check in the face to look for regular reflexes, kind of like your doctor's going to, tap your knee and things like that for reflexes. You've got some of those spots on cats too, and nothing abnormal there. But we know that that's not necessarily the only thing we can do to rule out disease inside the brain itself, and so recommended referral to a veterinary neurologist to see if there could be something going on inside the brain, not just on a behavioral level, but on a physical anatomical level. So they fortunately pursued MRI of the brain with the neurologist, in which they did diagnosed a pituitary tumor that, unfortunate for her, but fortunate in the sense that it was treatable, was treated by referral to radiation oncologist with stereotactic radiation, and the cat lived another, I think, year and a half to 2 years after that time. By that shrunk the tumor, a lot of those signs resolved, at least for that amount of time until she became sick again later on at the end of that time.
Wow. So, what I'd love to know is, so many things that you guys tested at first came back like normal, normal, normal. What tells you that you can't just check off the box and be like, okay, it's not physical. We've ruled out, that. What tells you to keep digging deeper?
Yeah, it's a great question. The first is there's this saying we have, which maybe you've heard before, that sudden change in behavior is physical until proven otherwise. And so I kind of die on that hill to some degree. This cat who never had any of these issues all of a sudden is so different. I'm going to be ruling out all the different body systems I can until we're sure we've pulled it out. And then behavior is going to be that sort of backdoor differential, and that if I've checked off all these boxes of what could be causing this, which is many, many, many things. They're such non-specific signs. Pacing in the house, she was circling to, not being playful, litter box changes. It's such non-specific. There's so many things that can cause that. Basically, anything that causes discomfort or pain or for you to feel differently in anywhere of your body could cause things like that. So we just hadn't fully ruled out all the things. And at that age, you do start to worry about things like cancer and tumors. And ones we know that although you can often have neurologic signs from a brain tumor, things like seizures, circling consistently in one direction, head tilt, tremors, things like that. It's not always the case, and there's a decent percentage of cases where you could have a brain tumor and normal neurologic signs.
So interesting.
Mhm.
And unfortunately, I think, the deeper you dig, the more expensive it gets, right? Like these more advanced diagnostic tests, CAT scans, MRIs are more expensive than x-rays, which seems to be like the first thing, x-rays, blood, that people do, which that's great. You need those too. But like if you get the x-rays and the blood back and it's normal, now we're like really escalating the cost. So I'm always worried about recommending those because they're so expensive. I'm like, "Oh god, what if it comes back completely normal?" And they're like, "Thanks for costing me 5 grand." You know what I mean? Um, is there a good way to know that it's gonna be worth it?
It's so hard because you're absolutely right. Good veterinary care, good specialty care, it is expensive. I've been there myself with my own pets. My one was the poster child for pet insurance. I mean, for sure, we won on them with that dog, the amount of things that we went through. She, towards the maybe last 5 of years of her life, she had a cancer in her chest that fortunately was localized. They could remove one of her lungs. She had a stroke in her cerebellum, so we needed an MRI with the neurologist for that. And then at the very end, about a week of a hospital stay for everything. So, for sure, pet insurance makes such a difference. It really is very, very helpful when families do have that to offset those high costs. But in some cases, people don't, and that's challenging. I guess the way I approach it is it's really not my place to choose for people what they can and can't do. So I try to present it as here's our options. Option A is this, pros and cons, things we might miss. Option B is this. And I try to, along the way, for anything that we think could have a physical component to it, or we haven't maybe ruled out all body systems yet, is to say, and you could spend all that money and it could be normal. And in some cases, your dog could or cat could have pain and you could do all these tests and it could still be normal, right? Not every diagnostic is sensitive for every issue. So
Yeah.
I just kind of put it in their hands. So it's not, I try not to make it my choice or my fault or anything like that. It's really up to them and their pet.
It's so tough. Are there certain behavior changes that are more concerning than others that you're like, we really need to get to the bottom of this. It's definitely a signal something's really wrong.
Yeah, the time I really push for a workup more than others is something suddenly new. Suddenly new and suddenly different too. So I've had a string of a few senior patients come in with sudden aggression. No history of aggression ever in the past. And the aggression is always with a physical interaction, being picked up, being approached, being pet. And this is a dog that was fine with it before. And the one case that we've just worked up, the dog has significant arthritis and is responding really well to pain medication. So suddenly different. We also know, especially when it comes to aggression and pain related aggression, a dog could have symptoms before of aggression. And those dogs are suddenly going to be more impulsive with their aggression. So, more likely to bite quickly, bite without warning. So, a sudden change, even if I had an issue before, if it just is suddenly worse for a reason, and when we have our discussion, there's nothing different in the environment that's stressing the dog out like crazy all of a sudden. Nothing's different with their pain medications. It's not like a new person's giving them or we've changed the prescription of what company's making that medication or anything. So you kind of check those boxes. So suddenly something that's really different for the patient, out of character for them that they didn't do before. And that could be at other situations, things like night waking. All of a sudden they don't, wake through, they're not sleeping through the night. Or I had another good example of a patient that had a pre-existing behavior disorder, so they've got both, and then something suddenly changed. This dog had symptoms of separation anxiety before coming to be treated by me, but the day before they came, they had had some sudden worsening, and the owner put them in the crate for one of the first times, and unfortunately, they fractured most of their canines of their teeth trying to get out of the crate, very sad. But that dog ended up being hypothyroid, so low thyroid, which can affect your stress response and how you feel about things. So that sudden change indicated something else was going on here.
Yeah. So a sudden change is always a concern, but what about something that a pet parent's like, they've been like this since we adopted them or since they were a puppy, but it's still abnormal for their species, right? Like it's not normal, but my cat's always done that. So they're just weird. Is that a thing or is it still a concern?
Yeah, definitely. And it sounds like you're asking, is that a concern for physical illness as well
Yeah.
as primary behavioral illness? For sure. And in the cases where that happens, because you can have an issue from an early age. For example, I had a really young patient we just diagnosed with hip dysplasia when she was 10 months old. So that dog was significantly painful, but things were also kind of progressing in a way. And when we had the discussion, there were certain things that aren't normal physically. So beyond the fact that the dog was becoming aggressive when they'd help the dog into the car, when we asked about mobility, this dog was now bunny hopping when it was running, so both back legs together. It's also a classic sign for dogs that go up the stairs if they bunny hop that could be hip dysplasia. Other considerations were that, exercise tolerance was less, so this young puppy suddenly is playful, less, unable to walk quite so far, things like that. So things that just aren't normal for that situation. It didn't really fall into a category of things that I typically see. As far as aggression disorders in general, there's just certain things that we see often. We can certain categorize them into a certain way, like possessive aggression, items or high value food that triggers aggression, fear induced aggression, aggression we see with fearful body language of new people, stuff like that just didn't really fit into a category. So that's
Yeah.
another consideration.
Yeah. So, what can a pet parent do if they are concerned, but they went to their vet and a test or two came back normal? So they're like, they're fine, but the pet parent's still concerned.
Well, you know, there are a lot of astute primary care veterinarians that can manage behavior cases. And if things are going well, they start treatments that would be appropriate and the patient's getting better with those treatments, then that's great. In cases where maybe the things that they're trying are not going well, that could be an indication we're missing something or that it's just not the right treatment for the pet. But there's always a good idea to refer to a veterinary behaviorist if the pet parent feels like they're not getting a hold of the symptoms, like it just isn't going how they feel like it should. And behavior change does take time, but if you started a medication in the time frame that your vet said they should be getting better, maybe they've adjusted it and you're just not seeing progress, that's always a great time to consider referral. For me, I like to have veterinarians and trainers refer patients if the patient is at risk for hurting themselves, if they're at risk for hurting somebody in the home, if we have kids involved, and what would be my last one? Those are kind of the big ones. Oh, and if it's a puppy. So, first year of life, puppy, kitten, we've got this limited window that if we can make some aggressive changes for this pet, in that time frame, they're gonna have a better outcome than if we wait and end up referring after they're fully grown past a year of age. So, in that window, it's always a great idea if it's an option for you to consider referral to a veterinary behaviorist so that we can make sure we're leaving no stone unturned because that's the expert to rule out other things that could be playing a role.
Yeah, and you guys have a little bit more insight into what kind of ailments show up as particular behaviors, yeah?
Yeah, and I really can attest to that because I was a primary care veterinarian for 5 years before I did my residency, and I learned a lot, a lot. I feel bad for the people that I saw, in my primary care days. They did a great job, but now I know so much more about what can manifest as behavior that actually isn't behavior change. Physical health diseases, pain, signs of subtle pain. The classic thing that I think owners look for is a dog who wouldn't be jumping, wouldn't be running. They're vocalizing, they're limping. And those dogs are probably in significant pain. And we're missing a lot of those mild to moderate signs where they actually might just change their gait a little bit. They stand a little different, they shift their weight a little bit different. Maybe they're not completely weight bearing, but not enough that someone who doesn't have the trained eye is going to catch it. So there's a lot of things that I've learned about that and gait analysis since then that helped me catch a lot of things.
Yeah, I mean, it's such a good point. Like, vets are amazing, but they are asked to do so much across so many species and across so many disciplines that I don't think your vet will be mad if you take them to a specialist.
Yeah, and in a very short amount of time. I worked in many different practices because I did relief work for a couple of years as a general practitioner. So I saw about 45 different hospitals, how different, appointments were run from 15 minutes to 30 minutes. It ultimately is a very short amount of time. So a veterinary behaviorist can spend an hour to an hour and a half with that patient, watching them in the room. And it's often in a way that it's a different setup. It's not quite so stressful of an environment. Sometimes it's quieter, that patient can really kind of settle in, walk around, and you get to see a bit more. So it's for sure no shade to a primary care veterinarian. It's just that
Mm,
oftentimes you have to be able to spend some significant time or even have owners get videos that they can send to you with that frequent communication you may get with them as a specialist.
yeah. To be honest, the reason that I love this topic so much is because, I'm usually the first person that someone's coming to when they have a behavior problem with their animal, right? They're coming to like the trainer, behavior consultant people, and we always refer them to the vets first. That's the responsible thing to do. And it's just really frustrating when their primary vet either looks at them and they're like, they're not in pain, or does a couple of tests and they're like, they come back fine. And I'm just really sure that this animal is in some kind of pain, and it's really hard to push past, the vet. Or I have a case right now, it's a 4-pound Yorkie. It's like 5. He has I thought he was limping. The orthopedist says he's skipping, which I guess is more for the, knee, that because I thought it was in his hip because he like, whimpers if you touch his hip. But, he has never warmed up to his father. Like, he has owner-directed aggression after 2 years, of doing all the right things, and so I'm like, "I'm pretty sure he's in pain, guys." She's taken him to 3 orthopedists, and one has said he needs surgery, but the other 2 said he doesn't.
Hmm.
She really doesn't know what to do, you know? It's
Yeah.
really tough.
Yeah, some of the ones that I find really challenging are in those specific cases, the dog is showing aggression to the owner or has a bite history, is not safe with certain physical handling. I can't do a physical exam. I mean, the first thing is a normal physical exam does not rule out pain. Right? And so many of these dogs that come through, at least to me, but I think a lot of veterinarians, they're scared. And the way that we're taught to evaluate for lameness and pain in veterinary school is to take the different joints, manipulate them, flex them, extend them, feel for crunching or crepiness, as well as reduced range of motion so it doesn't extend so far, or some sort of obvious sign of pain from the pet. So vocalization, looking back, trying to bite you, stuff like that. But there's so much more than that that we really have to become good at our visual exams to look for things. So I find that videoing the patient at the level that they're on, so having a separate the handler is walking the dog and another party is videoing in parallel from the side can help with gait analysis for these dogs that maybe they're really stressed in my room. I'm not going to watch them walk around. It's also a pretty small room. And then watch them from behind and video that as well so that they're seeing them straight in front and I can watch to see, do they have a hip sway? Are they planting one foot harder than the other? Are they taking a shorter stride than the other? So those are things that are really helpful as adjunctives for these patients we can't necessarily handle. And for sure, in the case where they are really stressed out, sometimes we're working on oral medications so they'll be more relaxed for visits. So I can look to see when you turned back when I touched your hips, because that feels a little invasive for a lot of dogs. Was that a fear response or a pain response? Now I've controlled your fear, it seems, and you're not looking back at me. So that kind of helps me differentiate between those serial exams for patients that I know. But a lot of them, I think, really benefit from a sedated exam. If they're not getting a full exam, if they're really stressed out and scared or aggressive, and they're freaking out and super tense like that, to get a sedated exam, orthopedic exam, and then imaging of places that we're concerned about. I think that has its place for sure. And again, it does come with cost, but sometimes we have to look to know what's there or not there.
Yeah. And again, imaging wise, I feel like a lot of them will do x-rays. Are there a lot of things that you can't tell from an x-ray? Is it oftentimes worth going to the more advanced scans?
Yeah, it depends on what you're dealing with. I mean, we always are going to look at things like breed incidence, right? So, dogs that are predisposed to luxating patellas, if you have it, I'd really like to see what that joint looks like to see, do you have really significant arthritis? How is that looking in those joints? It's a good place to start. It's also a less expensive diagnostic, right?
Definitely.
Although it carries its own expense when we're looking at things that's going to be ideal for maybe seeing a big tumor somewhere, or if we've got orthopedic problems in the sense of something you're born with, like elbow dysplasia, hip dysplasia, arthritis secondary to other issues. Sometimes we find a patella that's sitting outside of that groove that we maybe couldn't tell because it was more advanced and I can't really manipulate it at this time outside of where it lives. But I see on an x-ray it's not sitting where it should be. So it definitely has a lot of help for that arthritis of the spine. But for our patients that have neurologic issues, like a spinal disease, intervertebral disc disease, kind of our classic dachshund, French bulldog issue. Sometimes anomalies, we can see those on x-rays too, like Frenchies get butterfly vertebra or hemivertebra. But for spinal cord stuff, we really need MRI to evaluate that. But even then, it's not the end all be all. So I have a friend who's dealing with a nerve issue. The dog has a hip sway, and you kind of think about orthopedic disease with that. But when they did imaging, it was not that. And this dog had normal MRI, normal x rays, and really on tendon ultrasound, it sounds like, did they identify more of those abnormalities? So sometimes when you think there's an issue, you really have to kind of keep running that down. But in the meantime, things that can be helpful are analgesic trials. So we don't always have the opportunity to do our diagnostics. We can't always do them right away. But if we have signs that point towards pain, like we said, a sudden change, and I don't have evidence of other physical illness, I have in my visual observations changes, like the dog sitting funny with its legs sitting out, or the way they stand isn't normal for what we expect for a normal conformation, then we can just start our pain medication trials because diagnosing that pain or issue isn't helpful for the dog's welfare. It's really treating it that is.
Yeah.
So often we're starting those treatments and seeing does that patient improve as well. Often that's kind of a test in itself.
And the pain trials, they're usually what, like 2 weeks?
It depends on what we're dealing with. We might do pain trials with an NSAID, which might be 2 to 4 weeks depending on the dog. We've got if we've got neuropathic pain that we're more concerned about, we could be trying things like gabapentin or amantadine. So it just kind of depends. In some cases, we're doing all 3 and we might introduce them in the course of a week. I have a cat right now. I'm concerned that there are some litter box issues as far as caused by feline idiopathic cystitis, which is a painful condition causing them to have blood in their urine from the lining of the bladder wall and looks like urination, maybe defecation outside the box. So, because that's on our list, but we also haven't ruled out spinal disease, we're going to be doing a couple different medications as a pain trial to see for that cat.
Yeah. I think pain trials are great. Some vets are not excited to do them. I've had some, vets tell my clients, "No, we won't do a pain trial." So obviously it's up to the doctor that you're dealing with, but, um, yeah, I mean, if pain medication improves their behavior, then guess what? They've been picking,
Yeah, and
you
sometimes it's a
know?
little bit complex, right? So there's medication to
Yeah.
have multiple effects, like gabapentin is a medication that treats seizures, it treats neuropathic pain and anxiety. So I can't always slam dunk say, okay, for sure this patient's pain is better.
Mhm.
But in a case where I have that as my leading suspicion, certainly it makes sense to kind of continue down this track now if we saw improvement with that. For arthritis, that could mean maybe we're also adding in anti-inflammatory supplements like fish oil. We're working on weight loss. There's other therapies these days that are available too, like Librela, stuff like that.
Yeah. Well, I think if anything, we've kind of pointed out that the person for this is a vet behaviorist because they're really the only person that can look at the whole picture medically and behaviorally and how they interact. So, I know it can be hard to get into a vet behaviorist. Do you do video? Because I know there's a link to a consultation on your um, Instagram. Is that available to everybody or just people who are local?
Yeah, so the goal for that is people that don't have a veterinary behaviorist near them or a referral service like what we have, that they can't make it into our hospital. We still have a way to help provide some support. I would say, in my personal opinion, it's always better if you can go see a veterinary behaviorist in person. There's things that you'll miss. But if you don't have that as an option, that's another second best option. So that's consulting through their primary care veterinarian to help that patient. And there's a couple options there where either I can provide some support to the veterinarian where we're going to have a video chat or a phone call up to a certain amount of time. They're telling you about the case and I'm just kind of helping them manage it. And then there's the more formal option where it's sort of a full assessment. I'm getting the medical records from the primary care vet, a questionnaire form filled out by the client, and sending comprehensive information back to the vet, especially if they show me videos that I review as well that they're going to cover with their client. So there's a lot of different virtual options available if you don't have one in your area. But I agree. A veterinary behaviorist is going to be trained typically in all the primary behavior disorders. So, recognizing that and treating that, and recognizing physical health issues, diseases, and pain issues that can look like behavior and create a full differential list of everything that should be on our list for certain behavior changes for that. But of course, is really important to work in combination with the primary care veterinarian to help treat the patient and other specialists. And that's what I love about working in a specialty clinic. I work very closely with our internal medicine, our physical therapy team, sometimes surgery, because there is so much stuff that we find, and I'm not the best person to treat some of those things. So in some cases, I find it, I diagnose it, and then I need to send to the right person to stabilize that better than I would be able to. Some things like Cushing's and, we have a patient that might have copper storage disease, a congenital issue. So it's stuff that is not my lane. I'm going to in my lane, but want to make sure that we're all working as a team to help the patient best we can.
Yeah, for sure. Because I know here in Los Angeles where I am, there's not very many vet behaviorists. I mean, to be honest, there's not that many boarded vet behaviorists in the world. We know that, right? There certainly are vets that have chosen to specialize in behavior without becoming, doing the residency and the boarding. So that could be an option. But I think the wait list for the vet behaviorists that I've worked with the most is like 9 months right now. So I always say, get on that wait list. but in the meantime, you can do usually a vet to vet consult. Like a lot of vet behaviors, that can happen a little bit faster. I'm not sure why, but um, a little bit sooner than that.
Yeah, yeah. It's nice that I think that's just going to be coming up more and more. People getting into that digital space and trying to help fill in those gaps where they're able to do so. So I think that's a really positive thing happening in our field, and the ability to do telehealth that so many veterinary behaviorists do telehealth, where they see the patient in person. If their state requires they have to see them first, but then they can help them for a certain amount of time through the computer, which is a great option for cats. I think if more cat people knew that there are those recheck options virtually, that they might be more inclined maybe to refer or go seek out help if just that first appointment is in person and other ones can be through the computer. Also helps you see into that patient's environment in their home to get a better idea of some of the factors we're dealing with. Like, I can literally be looking at your litter box in your home because you brought the camera over there without necessarily having to be there to see it myself.
Yeah. Yeah. That's awesome. Awesome. Is there anything else that you want to make sure you get to say before we sign off? Something that you wish every pet parent would know, or something that's like a really common misconception that you're always dealing with?
Yeah, I mean, on the theme of pain and physical illness, I do find some pet parents that they think their pet is painful. And and this is sort of a message to veterinarians and to pet owners is I think nobody knows their pet better than the pet parent does. And because it is hard to find pain, especially when they're scared in our offices. I just would really advocate for pet parents to believe themselves, trust their instincts. If you think something's wrong with your dog, in a lot of those cases, I find there is. So I'm just going to believe a pet parent until proven otherwise because they know them better than everybody else does. So if someone thinks there's a problem wrong, definitely good to go to your vet. If you feel like you're not necessarily getting the diagnostics or plan that you want, to just advocate for it. Second opinions are always there, and veterinary behaviors are always there to help as well too if you think there's something that's not being figured out.
Yeah, awesome. Totally agree. If you guys want, you can find Megan on Instagram at Long Island Behavior Vet. And like you said, there is a link on her profile to book a consultation. Thank you so much for taking the time to talk to us today. I really appreciate it.
Yeah, thank you for reaching out, and I'm glad that you found the case report interesting, and I hope that it helps other pets through their veterinarians and things like that. So thanks for having me.
Yeah, I should mention I will link that case study in the show notes if people are interested in reading it.
Yeah, great. That'd be awesome.
Yeah, awesome. Thanks so much. Thank you for listening to the Enlightened Pet Behavior Podcast. I hope you and your beloved pets have found valuable insights for a more harmonious life together. Please remember that this podcast provides educational information only and is not a substitute for professional veterinary or behavioral advice. If you need personalized support, please don't hesitate to contact me and we can explore how we can work together to achieve your pet behavior goals. You can reach me at enlightenedpetbehavior.com or via email at susan@enlightenedpetbehavior.com. This episode was edited by Monty Light. Special thanks to Mac Light for composing the podcast's music. You can find him at maclightsongwriter.com. Treasure those fur babies, and I'll talk to you next time.